We got to talk about health Mondays at 2:45 on our Hello Doc segment. And seeing as we are in the month of November and there's awareness creation on diabetes, we're going to talk about diabetes this afternoon. I've got Dr. Emefa Dzide joining me in a moment with Hello Doc.
Hello, Doc.
Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Good afternoon, Doc, and welcome. How are you doing?
Very well.
Your weekend was good?
Very good.
We missed you last week. We had some good education though on diet for diabetics, and it's good to have you today.
Yeah, it's good to be back.
All right. So today we get to talk about diabetes proper. Get to know the disease, get to know the risk factors, get to know what causes it, prevention, and all those other things. So you're welcome once again. First off, as always, let's on a general note, when we say diabetes, and I was told that we have diabetes mellitus. That's what we're looking at today.
Yes.
Okay, so I'm sure there's going to be some differentiation along the line, but what is diabetes mellitus?
Okay, so diabetes mellitus is a condition that occurs when you have persistently high blood sugar. Yeah, so that's basically diabetes mellitus. Usually when the pancreas is not able to produce enough insulin, or the insulin is not working well enough, or the cells are not absorbing the insulin, they are not responding to the insulin well to absorb the sugar from the bloodstream.
Okay.
Yeah.
I don't know if this is a myth. If it is, we need to bust it. But you hear people say that when you eat a lot of sugar, you get diabetes. But you've not said that in your introduction. That's why I'm bringing it up. Is that the case?
No, not at all. It's maybe a contributing factor, but eating a lot of sugar in itself, we can't say it's directly a cause. But if you're taking a lot of sugary foods or a lot of high carbohydrate foods, it stresses the pancreas to produce a lot more insulin. Okay. So if you have a machine and you are overloading the machine with work, at a point in time it will break down.
Yeah.
Yes. So basically that's what we say. That's what we mean when we say if you take too much sugar. Yeah. Okay.
All right. So let's go on with it, and let's look at the risk factors for diabetes mellitus. Which people are at risk?
Okay. So diabetes, we have type 1, type 2, and then the gestational diabetes. Okay. So gestational diabetes, it's usually from a hormonal imbalance due to the changes that go on in pregnancy. Okay. Yeah. So with that, if you are pregnant, then you're at risk of gestational diabetes. But type 1 is more of genetic based, and it's more of an autoimmune disease kind of. So it's probably less than 5% of the types, the diabetes we see. And type 2, that's the commonest one. About more than 95% of the cases of diabetes that we have. So with type 2 diabetes, it has a genetic component and also a lifestyle component. So you are more at risk if you have a family history. If your father, your mother, your siblings have diabetes, you are at a higher risk. But that does not necessarily mean that if your mother has it, then you definitely get it.
Because it scares me. My dad had diabetes. My mom is diabetic. So sometimes I feel like automatically I'm going to have diabetes, right? At some point in time.
If you monitor your lifestyle very well, you don't have to get the diabetes. It's not 100% that you by all means get it. Okay.
You're at risk, but not 100%. High risk. Yes. Okay, but not 100%. Yes.
Also, increasing age, above 45 years, is also a high risk for diabetes. But nowadays, we've been seeing a trend, 30, 35 years.
Young folks are getting
developing
diabetes.
So that's also another risk is in physical inactivity and coupled with obesity. So a lot of people are obese, and then because of their jobs, they sit at one place for a long time, like the market women. They sit at one place the whole day selling. And
even when they need something quiet, they will send somebody to, and then they will be sitting there directing affairs in the market.
So they are also a high risk of developing diabetes. Also, certain hormonal diseases like polycystic ovarian syndrome, hypothyroidism can also give you a high risk of diabetes. Being black race also a high risk.
Diabetes too black.
Yes, unfortunately. And chronic stress.
Okay, so those are the risk factors.
Yeah.
How do we diagnose diabetes mellitus?
Okay, so it's when you are able to detect the high blood sugar. So usually we do what we call fasting blood sugar. So you don't eat in the morning and you come and then we prick your finger a little, take a little blood to check the concentration of glucose in there.
Okay.
So usually if it's above 7, then it's pointing to you might have diabetes. If it's the fasting sugar is above 15, thereabouts, then...
And hold them.
Yes. The random sugar is not very
accurate
because depending on the time you ate and all that. But we also have the glycated hemoglobin that we can check. That one, it checks your sugar over the past 3 months. If it has been persistently high, we'll be able to see above 7%. So that would mean that it's diabetes. And we have the glucose tolerance test, which is a more complex test.
I think I sought to get further information on this last week because you're saying that if you do the fasting blood sugar and it's above 7, it could point to you having diabetes. Is it just a one-off test, or you need to conduct series of tests?
If you are on the borderline, like very close to the 7, then we would have to do other tests. We can do the glycated, or we repeat the fasting sugar for probably a number of times, maybe 3-4 times to be sure. But normally if it's very high on the very first test, that one is more or less a diagnosis.
Couldn't be as a result of the food that you ate the night before?
No, the insulin is supposed to, that's why it's a fasting sugar. So we've given your body enough time to be able to clear all the excess glucose from the bloodstream. So whatever is left, that means it still wouldn't be able to do it.
Okay. All right. What are the symptoms? Some of the symptoms of diabetes mellitus?
Okay. So the common symptoms is the excessive thirst. You feel very thirsty a lot, drinking a lot of water, and then also urinating a lot.
What do you mean by urinating a lot? How many times? I urinate a lot. I don't know.
It depends on your basal metabolic rate and all that. So I can't give a specific number, but at night when you go to sleep, you shouldn't urinate more than 4 times. So if you are urinating more than 4 times after you go to bed at night, then that's more likely a pointer to diabetes. But
some don't urinate at all.
During the daytime, it depends on your water intake and all this. So it depends on you as an individual. You know what is normal for you. So once it is above or maybe double that, then you should know that there's a problem. Another symptom is excessive unexplained weight loss. So that's also one of the major symptoms. Then the other symptoms, probably the eye symptoms, blurred vision. Sometimes they won't even notice until they just go blind all of a sudden. Then they realize that it's
happens
diabetes.
Like that?
Yes, it sometimes happens. It's quite unfortunate. And then there's the nerves. They have this numbness and tingling in the extremity, the fingers and the toes. But that one is not very specific to diabetes because any other nerve damage too can cause that. So, but very often we see that with diabetes patients as well.
Okay. All right. Is it treatable though? Diabetes? Is it treatable? If you get diabetes, can you treat it?
Very, very treatable. It's very, very treatable. Or should I say manageable? Because you don't cure diabetes.
You don't cure diabetes.
No.
You can manage it.
Yes, it's not like malaria that you take the medicine, you are
and then
cured.
It goes.
Yes.
Okay.
So diabetes is because it's a problem of the function of the body's organs. You have to take the medications to sustain or normalize what is going on. So you have to be on the medication for life. If you stop the medication, then the dysfunction will go back, and then the sugar will go up again.
Okay.
Yeah,
okay.
So,
but you have a lot of herbal medicine that we're told cures diabetes. That's not the case?
Not that I know of.
Okay.
I'm yet to see someone who has been cured of diabetes with herbal.
You've not seen some before?
No, I haven't. Maybe someone can prove to me that the person had diabetes before and after the herbal treatment it was gone. Usually what I have seen before is someone who was very obese, and then when they lost the weight, the diabetes itself regressed. And usually that is because the insulin resistance has been identified to be caused by fatty deposits within the cells.
Okay.
So once the person loses a lot of weight and then the fat is gone, then the resistance also wanes.
Goes away, yeah?
And yes.
Okay.
So probably that might be a cure for certain people, but it's not everybody that works for.
Okay. But you're saying that it can be managed. Can you walk us through how you manage it?
Yes. So important is the medications. There's oral medications. There's insulin injections. That's if the oral medications are not sufficient or they are not working for them. But an important aspect of the management is also your diet. It's very important to know the right way to eat. So the dietitians and the nutritionists are very important for the diabetic patient. They help them to be able to quantify how much they are taking in and then adjust the food, the intake and all that to help to keep the blood sugars stable. So they have a lot of good advice.
Yeah, I think we went through some of that last week, what to eat and what not to eat.
Yeah.
Okay. What are some of the complications that can arise from diabetes?
Okay, so diabetes, there's acute complications and then the long-term complications. So the acute ones is when the sugar goes very, very high. Probably it has accumulated for a long time. So we have the HHS, which will lead to probably dehydration, dizziness, and just feeling unwell generally. But we have what we call the DKA, which is ketoacidosis, where there's acidity in the blood. That's what can lead to the vomiting and even going into coma because of the high blood sugar. Okay. So those are the acute complications that can occur. So it's not only long-term high sugar that can kill you, but if it goes very high
within a short
time too, it can also kill you quickly. Long-term,
okay.
We have the other diseases, the heart disease, stroke, kidney disease. Once the sugar is high in the blood and it's not entering the tissues, it's damaging the tissues. So it will damage the blood vessels, it will damage the kidney vessels, it will damage the eye lens and all those things. So it causes a whole lot of problems. Glaucoma, cataracts, it can affect the eye, the nerves. The nerve damage can lead to sexual dysfunction.
Whoa.
The blood vessel damage can also lead to sexual dysfunction. So that's two attacks.
It's a killer disease.
2 attacks on
I'm like, you mentioned diabetes. It's like, it sounds normal, but it's a killer disease. It causes a lot of damage.
If you don't manage it, it will end up killing you slowly, very slowly. And sometimes you will not even notice the symptoms before you realize all of a sudden one day, then it's full-blown kidney damage or something, and sometimes it's irreversible damage.
What's the relationship? Because I know of people who've had diabetes and have had some limbs amputated. What's the relationship there?
Okay, so with diabetes, it leads to prolonged or difficulty for wounds to heal.
Okay.
And aside that, the nerve damage does not remove the sensation of pain. So someone can even have probably a sore on the toe or something, but because there's no sensation there, they won't notice they have a sore there, and the wound doesn't heal, and then it can lead to the death of the toe and all those things. And once there's a dead organ attached, like your toe or some part of the body tissue is dead, if we don't cut it off, that dead tissue will produce toxins that can kill you. Okay. So then people end up having to have amputations to prevent dying. Yeah.
Okay, I get that one. Now, how can people who are at risk of diabetes avoid developing the disease?
Yes, that's very important, because you are at risk. Probably we are all black, so family history and all those things. So the first thing is you have to have a healthy lifestyle. So healthy diets is very important. You have to avoid the highly processed foods. So you see, like the carbohydrates, the normal ones we take, it takes some time to digest. But the highly processed, those made with flour and those kind of things, it compacts a whole lot of carbohydrates in a small amount. Okay. So you think, I'm eating just a small meat pie. But before you realize, it has compacted like a whole carb of carbohydrates into a small volume. And then once you eat it, it quickly gets absorbed. So it's high sugar spikes. So you should avoid that by reducing those kind of foods, and then take more complex carbohydrates and those kind of foods. So more healthy foods, more fruits and vegetables.
Last week we talked about taking in fiber foods and all that. Yeah.
So once you do the healthy diet, healthy lifestyle, you've probably won most of the battle. Okay. Another part is to be physically active. Yeah, so you avoid sedentary lifestyle. So if you're a market woman, at least every hour or so, get up and then walk around a bit and let the blood flow a bit in the body. Don't just sit at one place the whole day. Managing your stress levels. You have to get enough sleep and don't overwork yourself. Okay. Take weekends off. Take time off from work. You don't have to work 24/7.
Go on vacation.
If you can afford. If not, just stay home and relax.
Okay.
You don't necessarily have to travel anywhere. Limit alcohol intake. So
this alcohol thing, every time they are talking about it too.
So limit it.
Limit it.
Yes.
Limit it. Okay.
Everything in moderation. Except for smoking. After smoking, stop.
Stop smoking.
Don't smoke at all.
It will kill you before diabetes kills you.
Yes. But the alcohol, just take it probably once a week or twice a week. Not too much.
Okay.
Yeah.
Okay. All right. That's great education. I don't know if there's anything else to add to it.
Okay. One last thing I want to say is, like, diabetes is not a life sentence. Sometimes I'll tell someone you have diabetes and the person will start crying in front of me, and your life is not over once you have diabetes. You just
they used to say, before you go on, they used to say that diabetes was a rich man's disease. Is that a
No. Now it's a black man's disease.
Pretty commme, right?
Yes.
Okay.
Yes.
All right. So let's hear you on that.
What's important is your mindset and your approach to how you manage the disease. The disease in itself is not a death sentence.
Okay.
Once you are intentional about what you are doing, you are monitoring your blood sugar, monitoring your blood pressure, monitoring your cholesterol levels. Every year you do screening tests, check your kidney function and those things. You should be able to manage and not have the complications from the diabetes. So it's about your mindset, having a good attitude towards it. But if you have already decided that diabetes is going to kill you, then
it will kill you.
Yes.
I remember a friend of my dad had diabetes, and my dad had diabetes as well. My dad is older. He retired before him. They were working in the same place. But, the food, the diet that they give them, he says he can't do it. No. If he will kill me, he will kill him. He died less than 5 years after retirement. He died. He had his leg amputated first, and then it killed. My dad lived for about 22 years after retirement, and because he was managing, and all that. So I get it when you say it's not a death sentence. You need to manage your diet, your lifestyle, and all that. And I'm sure we'll be fine.
Yes.
We'll be fine. We can live very long. Even with diabetes.
One last thing. If you have diabetes, you have to every year visit the ophthalmologist for an eye checkup as well. It's very important so that you can notice if there are any changes with your eye.
All right. Thank you very much, Doc, for coming on the show this afternoon. That was great education there on diabetes mellitus this afternoon on our Hello Doc segment. Don't forget that Hello Doc is on Mondays 2:45 here on the Drive with the Area Gang. So Doc is going to be back next week, Monday. This is the Drive with the Area Gang on PLUZZ 89.9 FM. The show